Hi, good evening. My name is James Luckett. Many of you know me as Jamie. I would like to take a moment just to introduce the ideas of what we're doing. This is an In Focus, a Wednesday night In Focus for Royal Lane Baptist Church. We are here as representing the healthcare community. We have 3 individuals that live and work in the healthcare community every day. And we had wanted to share our experiences during this, during the COVID-19 pandemic, and our experiences within within the healthcare industry, our experiences with working with our patients, and other thoughts. With me here tonight, I have Rosa Belgard and Marcia McCrae, and I would like them to spend a couple of minutes introducing themselves. Rosa, would you start us off, please?
Sure. I've been a registered nurse now for 38 years. I decided 18 months ago that I was going to take up a new specialty area and have been doing hospice nursing for the last 18 months. I've done a lot of other things in nursing. My clinical specialty area is psychiatry and mental health. And so that's kind of where I'm at in my career at this point.
Marcia, would you tell us a little about yourself, please?
Yes, I am a physician assistant at Medical City Dallas. I work in surgery, primarily in orthopedics and plastics, and I've been a PA for about 35 years, graduated in 85. And so my expertise really is on surgical patients in the inpatient setting.
Okay, thank you.
Mm-hmm.
Well, my name is James Luckett. I have a doctorate in nursing now. I became an LVN in 1980 and a registered nurse in 1981. And so I've been a licensed nurse in Texas for 40 years, which is hard for me to believe. The first 20 years of my career, I worked mostly ICU and the emergency room. And I became a nurse practitioner in 1998 and practiced in occupational medicine since 1999. Currently, I have, for the past 17 years, worked and ran an embedded clinic located in Grand Prairie, Texas, in Lockheed Martin, where I serve this community of 4,000 to 5,000 professionals that work in the defense industry. Thank you, Rosa. Thank you, Marcia, for being willing to participate in this In Focus meeting. And I was wondering if each of you would take a moment and just give us an example of how you are able to continue to provide care in the community during the COVID-19 pandemic. Rosa,
Sure.
would you like to start?
I will. My role is very active role anyway. So I am generally all over the Metroplex. I see patients in their homes, in memory care centers, in long-term care facilities, assisted living. And I'm responsible for the coordination of the team that works with me at our hospice agency. And I think probably one of the things that has been one of those constant moving targets during this process is how do we gain access to our patients? The guidelines that came out fairly early was that the facilities needed to shut down and there would be no more visitation and very few outside professionals that were going to be allowed to come in. So at one of my facilities, they found that there was a Medicare guideline that said they only needed me to come every 2 weeks. So I get to see that patient every 2 weeks instead of every week. Some of my other facilities will allow me to come in and the certified nursing assistant to come in. A couple will allow the chaplain also. And our poor social worker, she's been shut out of just about everywhere. So they do a lot of work still with families and on the phone. So that's been one of the challenges is just to always keep the needs of the patient and the family met while still juggling how we can best do that. So we do that by presence and phone and televisits and lots of Zoom meetings.
Lots of Zoom meetings. Marcia, how about you? How has your life and patient care changed?
Well, ours is a little bit different because, as Rosa alluded to, the hospitals really narrowed things down to very essential people. In terms of surgical procedures, nothing elective could be done. Anything that was not, urgent or very, at least either people, those patients had to wait on their surgery. Unfortunately, or actually fortunately for a job standpoint, everything that we do, people still fall, they still get bone cancers, they still have, cancers that require reconstruction. So it was for us a little bit of a, a decrease in our census, but we still were working every day, busy every day. And we watched as the hospital just sort of evolved into the best way to, to limit the spread and to at least, flatten the curve for, other contacts. And Rosa already mentioned that, we immediately stopped having visitors, which was a very weird situation for hospitals because patients were now all alone facing surgery, some of it life-threatening surgeries or limb-threatening surgeries. That was probably one of the biggest things. We kind of joked and said, wow, we haven't had to instruct anybody how to get to the cafeteria in a few weeks, But, that's probably been one of the biggest things. We now walk through a toilet every day. We, have our temperature taken and brand new mask and all that evolved. At the beginning, we really didn't know what we were doing because we were wearing gowns and gloves and masks every single day. And now it's come down to just, doing our mask and gloves every day and wearing mask all, throughout the day, no matter what, and to the point where I think even 2 weeks ago, it was mandatory that the patients we were seeing put on a mask. So that was one thing. And then I just, the other big challenge that we saw were, just when we were anticipating a big surge of cases, all the different floors, like even our recovery room was turned into a COVID floor. Our ICU was turned into a COVID floor. One of the, all these, we had probably 3 or 4 units that were just ready and waiting for this surge. And at Medical City, it didn't happen. And so now we're back down to just a couple of floors, a couple of units that handle our cases. But it all kind of, like I said, was a very dynamic process. It was constantly changing. And in some ways, it was a little frustrating because there was a lot of miscommunication from all the levels from administration down to nursing management. But I think by this time, I think we've all gotten a little bit ahead of the game now, and we kind of know what we're facing. So that's been probably the biggest change in the beginning. So that's about it.
So I've experienced some similar things to both of you, a little different in industry. Like you said, Marcia, people still cut their fingers and they still have injuries and they still hurt their backs. And so those people still needed to be seen. I was grateful for continuing to have employment and to work, and that was never an issue we were seeing as essential workforce within this industry. We also still see people for surveillance exams. Some of the OSHA requirements have been modified, but they haven't been eliminated. And we've begun to visit with people again regarding those mandatory surveillance exams. We did find that we had a significant drop off when the county closed. A number of people that weren't considered to be essential were encouraged to work from home. Lots of our engineering professionals and many others that work here were asked to work from home if they could. And so our quantity of total visits per day actually dropped pretty significantly. That turned out to be a good thing because we were rapidly engaged in helping to monitor and to field questions for people that had been exposed or had been diagnosed with COVID-19, and about how we manage that. And then we've been also involved in the contact tracing element that's so important to control the spread of the illness. It still is exhausting work. I tell people that first thing in the morning, especially on Monday mornings, I feel like I'm Dorothy in the tornado. I get sucked up into the clinic spin, from the moment I walk in the door.
Yep.
Then you combine that with PPE, it can make for a long day. It really can. I had wondered also if both of you would speak about how you protect yourself, your patients, and your family during this time, as we know that we're on the front lines. And Marcia, I wondered if you would provide some insight around that, and then Rose.
Well, I think, we've protected our patients, obviously, by having the right kind of personal protective equipment. And we've been very fortunate to be, Medical City is part of a very large hospital corporation. And so we have access to everything that we need. So we're incredibly fortunate in that regard. We protect ourselves, hand sanitizer everywhere, washing your hands, things that we normally would do, because some of our orthopedic patients having, prosthetic joints, that makes them at higher risk of infection. So we already have this operating room full of people walking around in spacesuits and not touching anything. So that's already our thought process anyway. But I would say that, we're a lot more aware of how much we touch people, which you didn't really think about before, because it's such a, it's such a hands-on, when you care for people, it's such a hands-on situation. But for me, March 15th, I brought my mom to my house, and I wanted her to stay with me because of, a really strict, actually no visitation policy where she lived. And so for me, it's been a matter of being extra careful, coming home, making sure that all you wear is your scrubs and you take those off and shower and everything before you come upstairs, especially in the beginning, and just have minimal contact with your, with your family, which that's also, it's been a real adjustment. But, just to have, just sort of that, how to make contact with patients and family without being as, abusive as we tend to be, because we're caregivers and because we love our families and we love our jobs. So I think that's been, one of the big take-home messages for us for this.
Thank you, Marcia. Rosa, can you talk some about your experiences? And I see you have.
I can. This is part of what I look like when I go into my patients. A lot of them have dementia, so I've got my gloves on. Those really are a warm touch for folks. And then this mask, and here's the real zinger, is my face shield. So it blows in the wind when you get out of the car, and it really can be quite challenging to do that. But those are the things that are so necessary with the gloves and the hand washing, alcohol hand gel. I wish I had stock in that stuff. I am more aware of all of that, than I was before. I still miss touching my patients because that's always been part of my nursing practice. I think a lot of the things, that have already been said, you go straight to the washroom, you taking off all your shoes and uniforms, putting them in the washer immediately, and doing those same kind of precautions. I struggled with, am I going to spread this virus? I haven't been sick with it. We wanted on a trip to Arkansas to see our grandkids. We hadn't seen them in 4 months. And so I kind of get this internal thing going on. So we decided we would go, but I did put a lot of thinking and worrying into what if I take that virus up there to my grandkids. So that was hard.
So I can mirror a lot of those thoughts. Rosa had her face shield, that sort of thing, and I have my own. So typically I'm in an N95 mask, and as befits industry, I have an industrial face shield. So when I'm seeing patients face to face, particularly if I'm doing any kind of activity that might have them where I need to look in their throat, or if I need to swab them with for flu or anything else, this is kind of my outfit. You add that with a surgical gown, an isolation gown, and that's my day-to-day work is putting these things on and taking them off and getting my hands washed after walking out of each patient room. So we are more aware now. But it makes it a real challenge to communicate well with patients. It's hard for them to hear you. It's hard for me to hear them. And so those are challenges. We also switched over to a fair number of video visits in terms of pre-screening our patients before they came into the clinic. We were working hard to not, we were embedded in the center of the manufacturing facility. So we didn't want people who were ill to routinely come in through the doors onto the grounds. And so we did a really massive campaign, and Lockheed did, to have them call us and to route any kinds of concerns about fever or anything else to us by phone, which I'm grateful for. That limited the number of cases that I could potentially be exposed to a large degree. It's also been represented a number of challenges in terms of not being able to interact and to touch base with those individuals that I've come to know. So we've talked about protecting our families, that we've talked about protecting ourselves and our patients. Are there other issues that perhaps have played a role? The Black Lives Matter movement, some of the unrest in the street, all of those may be some issues for you. Have either of you run into any concerns regarding other issues on top of COVID-19? Yes.
I think that it's just been an added layer. I'm always on my phone in some news channel, and now it's, going back and forth between COVID-19 and back and forth, through the racial unrest that we're having, all over the United States and some other parts of the world even. So I have not had any difficulty or fears with worrying about getting to work, is any of those kind of things, or worrying about protest, possibly limiting me from access to my patients. So that part has been good. I did have an interesting experience of actually getting COVID tested myself. And so it was a case where one of my facilities had tested positive for COVID. It wasn't my patient, but I still, when that happens, every time you go in and you're screened at a different facility, they ask you, have you been in a facility with a positive COVID test in the last 14 days?
Right.
And so the first time that I was told, well, I need to ask you to leave, even though I was expecting it, I just went out to my car and wept. I felt like I was letting my patients down. I felt like I was letting my families down. So that was an experience that kind of took me by surprise, that made me so emotional. The other was getting tested. And like I said, I worried. It took 4 days to get the test results back. I probably checked online to see if they were there 6 or 7 times a day. Again, I couldn't go to certain facilities. If I got my test back and it was negative, some of the facilities would let me come back in. So those are a couple of things that, kind of impacted me and threw me off kilter emotionally.
Marcia?
I would have to agree. I have not had any difficulty getting to work or, going through any, areas where there have been active protesting. We have a very diverse group of people at our hospital, and I know as a, privileged white person that there's not much that I can say, but I thought early on that there was something that I can do on an individual basis, and that is to have a heightened sense of treating every single individual of any color with a little bit more kindness and love and respect. And I think if that's a take-home message for anybody, is just you have to start where you live. You need to raise your awareness. You need to understand that our American experience is so different from other races, and just to love people on an individual basis and take it to work with you. And I think if I see any, there's a lot of people that have felt the same way, and I see that we're a lot more cohesive at our hospital. I have not had a situation where I have felt any great animosity amongst my coworkers. If anything, I think it's brought us closer together.
Very nicely said. I appreciate that. Could not have said that any better. So within your experiences, and this is for both of you, either of you, we've learned a number of new ways to be with people. We've learned ways to offer both care and support for our patient populations. Have you felt any positive changes? And Marcia, you may have already spoken some of yours regarding your experiences of working during the time of a pandemic.
Yeah, I would say in some regard, because, we already touched on the fact that there's no visitors, there's no family, people are there with nobody. And I think if anything, it's helped us understand the dynamics of people's families. You're on the phone with their family, you are more involved in terms of, providing emotional support for them. You find yourself going in and actually sitting with that person, whereas maybe you would just go from room to room and you're rushing through rounds if you've got 15, 20 people to see during the day. And it's just giving you more time to interact personally. And I think if anything, that's been trying to fill that emotional void that the lack of family has, that the lack of family and visitors has had, on the individual patients. And I think that's a positive thing. The only thing that I would say is that, and we've talked about that just a little bit, you don't realize how much your face tells the story of your empathy or how you are relating to people. And so it's made us be better communicators, because our patients can't rely on the fact that you're smiling at them and that you're caring for them. And it has to be in your eyes and your words. And so that's not a bad thing either.
Rosa, any thoughts there?
I would say probably one of the biggest impacts has been with the families also, and the isolation that my patients feel and the isolation that their families feel, not being able to go into these facilities and see them. And it has heightened my awareness that I am the communicator between these. So I am on the phone a lot more, like Marcia said, with families, a lot of reassurance. When my facilities, the two that had some positive COVID in them, that comes out on the news sometimes before the families or the agencies know. And so, my first call is to my family member who has a loved one there. And a lot of times they're trying to call me, around that same time, just to say, are you going to be able to see them? Will you call me and tell me what they look like? I go into my facilities and I've learned not to ask if I can do a FaceTime with a patient and their family. Some facilities only want you to do that if it's using their equipment and they set it up and stuff. So if my patient's doing really well that day and I think they'll recognize their family member on FaceTime, I just go for it, because any you can keep up between them and their families, I think, is just essential.
One of the things I've discovered is that as we've leaned on technology here and have used more video visits, I've discovered that at times, because my camera is here in the office and my EMR is here in the office, I am less encumbered. I'm more able to personal cell phone number to call if they had questions or concerns, or if they were getting tested and trying to get test results back and needing to find out whether they were allowed to come back into work. And so it's been an interesting experience of both sort of spreading out the hours of my day and availing myself, days and evenings. And fortunately, everybody has been very, very respectful of the time for the professionals that are here. So that's been my experience of it. And I would not have, before the pandemic, I don't think I would have relied that much on a technological experience, and then suddenly very rapidly to be exposed to using the technology and to providing diagnostics and heightening my sense of visual awareness about my patients and what people look like to diagnose and treat those individuals has been an interesting sort of positive note for me. So as we approach the hour, I just wanted to lastly hear from each of you about how the Royal Lane Baptist Church family can support us in our work and how we can support Royal Lane as we go through our days and times. Marcia, Rosa, what's your thoughts?
That's a great question. I had given it some thought about how we can be supported. And, I look around and, people are bringing things to the hospital and meals and discounts and all this stuff. I never really thought about the signs and the banners because it's just what we do. It's what we signed up for.
It's who we are.
And it's really hard to accept that, because it's just what we do. It's, it's just like the pastor going to the hospital to visit the sick people. It's just, that's part of their job. So I never really think about, what do I need from the community, because it just doesn't cross my mind. I don't know if Rosa, your experience has been the same, but it's just part of what we do.
Yeah, I do think, yeah.
I don't feel like I need my, to have a special anything. I'm just doing my job.
Yeah, I think it's humbling, how much people do try and figure out how to show their appreciation to us. In the midst of all this, we've had Nurses Week, and this is CNA Week, which are times that we usually gather and we eat and we celebrate. And that's been hard to do. And as I thought about and reflected on that same question, I guess I would say is just to ask some of those same questions that Jamie gave to us. How has this changed what you're doing every day? I certainly don't need a list of 15 projects I can do in a day or what to watch because you're so bored at home. Because
that's the truth.
Yeah, no kidding.
We have the admissions in some senses have increased for us because families know we'll be able to get and see their loved ones. So being curious and asking and just help us spread the message to wear face shields and wash your hands. And I go when I'm out sometimes, I just, depending on how tired I am or how bad the traffic's been, I just want to snatch some people by the hair and say, what are you thinking? Where is your face mask?
Right.
So those messages, both by example and by verbalizing them, I think are helpful for healthcare professionals.
Stay out of the mall.
Yeah. Yeah, absolutely.
Yeah.
I mean, North Park looked like Christmas.
Oh my.
When you drove by there, and I'm like, people, please, you know. So
Yeah. Yeah. So,
Well, I think that as we work through, and some of you know that Melissa and I are actually working on how to reopen the sanctuary and when's the right time to open the sanctuary, along with a gifted group of people that are absolutely helping us with that process. And know that we are absolutely doing our best to be sure that each member of Lane is safe and protected, and that we are hopeful to provide a mechanism so that we can, once again, at least share the same holy space with each other. So with that, as we've gotten to the top of the hour, Tim, I wondered if there were any questions in the chat.
So I want to actually invite folks who are watching to go ahead and use that chat feature to type any questions that you may have for our panel. We don't have a lot. I do have one. Jennifer asked, are there donations that could be provided to you or to patients?
plasma. Donate blood, because that's been some of the most successful treatments are plasma donations, which I know Royal Lane just got through sponsoring a blood drive. So we need blood.
I don't have a short list in my head for that. You know, we're not. We certainly have come across some patients that didn't have anybody to go buy groceries for them, and so you know they really, you looked in their refrigerator, there was nothing there, and so of course, like I said, we all kind of marshaled together, and so I guess I would say, you know, to my congregation, if I come upon those and it's something you can help me with, I'll let you know.
Good answer. And, you know, as we move forward in time, we will be watching diligently. I encourage each of you that watch this call to look at the daily new case rate. It's available out on the state health services websites. That I think is probably one of our more valid markers. It is a 3-week trailing indicator. So what you see today reflects the number of exposures 3 weeks ago. That's not a perfect answer, but it's a good mnemonic for remembering, you know, what we're looking at, what we're trying to understand as the pandemic moves forward.
I don't see any other questions. So let me say thank you to all three of you for this conversation. I think it's been really meaningful. It's something that I've been looking forward to. I enjoy these in-focus sessions. I had said at the outset before we started streaming, you know, this is the second in a series, and we're going to have some future conversations with educators and some others. And I love to hear how, you know, how everybody's sort of dealing with this, because I think we're all struggling together. And I think there are certain professions like yours where you struggle more. And I want to thank you for all that you do to keep us safe, even though that does put you in danger as well. So thank you for serving in that way. I think I speak for everybody who's watching when I say we appreciate you. Mm-hmm. And thank you for joining us for the panel and giving us some insights. I think that's been really neat and really helpful. So thank you. And I invite you all to, Charlotte echoes my thank you. Thank you, also Karen. So just, you're getting some kudos in the chat. So thank you for submitting those as well. I wanted to make sure you heard that. So thanks for joining. Join us again for the In Focus next month. We'll go ahead and communicate that shortly, and we'll go ahead and sign off. Thanks again.
Bye, Tim. Thank you.
Bye.